Hello and welcome back to OET Speaking Unlocked by Kirti Institute. In today's lesson, I'll teach you how to open a role play confidently. As a healthcare professional, you will begin the consultation. So it's important for you to understand how to start. In this lesson, I'll display four different role play cards with four different scenarios. And I'll show you different ways to open the interview. Let's get started. So, when you receive a role play card, first of all, you need to get connected with the scenario so that you can begin with the right language, with the right tone, and with the right voice modulation, I would say. So, in the first scenario, as you can see on the screen, this is the card of the pharmacist, and the setting is community pharmacy. So assume yourself as a pharmacist in a community pharmacy. Let's see what kind of patient we are about to meet. So I would suggest that whatever you are reading, you try to imagine. Okay, try to step into the scenario. So you are about to see, of course, it is written that you see a 28-year-old patient, but you need to start assuming. So you see a 28-year-old patient who has been experiencing sneezing, itchy eyes, and a runny nose for the past few days. They have come to ask which medicine will suit them best. Find out reason for patient's visit. Very simple, right? So we are about to meet a 28-year-old patient who has respiratory symptoms and he or she is here to ask help with the medicine. And we need to identify, first of all, that what is the reason for patient's visit. Now consider this as a walk-in patient. Okay, someone enters to the pharmacy and you don't know who the person is or why they have come. So now we will introduce ourselves. We may get the introduction of the patient and then we will ask the reason for patient's visit. Let's start. Hello, my name is Kirti and I'm a pharmacist in this community pharmacy. How may I assist you? You may also ask the patient's name. However, it's not mandatory. You may say something like this. Hello, I'm Kirti, a registered pharmacist in this community pharmacy. May I know your name, please? Okay, Mrs. Smith, how may I assist you today? Okay, so this is one way of starting your role play, and this is for the walk-in patient or when you see the task that begins with find out the reason for patient's visit. Now, in the second scenario, this is the role play card for physiotherapist. Setting is physiotherapy outpatient clinic. Let's read the background and get connected. Assume yourself in a outpatient clinic as a physiotherapist. Your patient is 68 years old and is recovering after having a total hip replacement surgery 10 days ago. They had physiotherapy sessions in hospital and this is their first outpatient visit. The background information indicates that patient underwent surgery 10 days ago. He or she has received some physiotherapy sessions during the hospitalization and this is the first outpatient visit. That means we are unaware of the patient, okay, who the patient is. But if you will look at the task that says confirm reason for patient's visit. So this is not find out the reason. Okay, we are confirming means we know the patient. So assume like patient has booked an appointment. So you know that this patient is about to come at 4 p.m. for the post-surgery physiotherapy sessions. You know, but you will be confirming with the patient. But as you are meeting the patient for the first time, you will definitely introduce yourself. You may get the introduction of the patient, and then you may ask either an open ended question or the closed ended question. But I would consider asking an open ended question first. So now please listen carefully. So you may say that, hello, I'm Kirti, a physiotherapist in this clinic. Uh, you are Mrs. Smith, right? Okay, Mrs. Smith, uh, what is your understanding about today's appointment? This is one way of starting, or you may simply say that, hello, Mrs. Smith, I'm Kirti, a physiotherapist in this clinic. You are here after having a surgery for your hip replacement, and you have received some physiotherapy sessions in the hospital, and you would like to continue the physiotherapy after your discharge, and so you are here for the follow-up physiotherapy. Is that right? Okay, both the ways are correct, and you may use any one of this, but the first one is better. Okay, now let's move on to the third scenario. Now, this is a role play card of medicine for doctors, and the setting is general medical clinic. Assume yourself as a doctor in general medical clinic. Let's read the background information so that we can understand that what kind of patient we are about to meet. You are seeing a 55-year-old patient to discuss the results of blood tests you ordered at their last visit 2 weeks ago. Wow, several information. 55-year-old patient, you ordered the investigations in the last visit that was 2 weeks ago. Clearly indicates that you know the patient. Okay. After they reported persistent tiredness and weight loss, so these were the complaints in the last visit. The results show mildly elevated blood sugar levels consistent with early stage type 2 diabetes. Okay, so you now can understand what's the scenario. Okay, patient is coming to understand what is the result of the investigation, and maybe later in the interview you will be discussing about the outcome. Okay, like early stage of type 2 diabetes, but in this lesson we are discussing how to open. Now in the known case, you may say that, hello Mrs. Smith, nice to see you again. You are here to understand the outcome of the investigations which we ordered last time. Yes? Before I explain you about its outcome, I would like to know how have you been managing since your last appointment? Okay? Or how have you been feeling? Here it is about feeling, not managing. So how have you been feeling since the last appointment? Okay? So you may ask this question. This is how you may open the interview. Now I have received questions several times that what name I can use for the to address the patient. Now, there are two things you can do for the known case, or even if you want to use the name when it says that confirm the reason for patient's appointment. In such scenarios, either you may ask the interlocutor their name during the preparation time, or you may assume any name and start. Sounds good? Yes. So, as I have started with, hello, Mrs. May, nice to see you again. Assume any name and you may start. Or ask the interlocutor's name during the preparation time. How may I address you during the role play? Okay. But when the patient is totally unknown to you, you may ask the patient's name even during the conversation. Okay. Now, let's move to the very important part of today's lesson, and another way to open an interview. And let's see, the card is for nurses. The setting says children's hospital emergency department. Okay, you see the parent of a 4-year-old boy who has been brought to the emergency department with a high fever and a rash. So here you can understand that you are not about to talk with the patient but with the parent. And as their child, just 4-year-old son, has high fever and a rash, absolutely the parent will be concerned. You are assessing him in triage and have just finished taking his temperature and other vital signs. Now, when you read such information that you have just finished an examination, you have just taken the vital signs, we believe that the interview is in progress. You have introduced each other, you have asked some questions already, and you have taken the vital signs. And from this point, you need to begin the role play. So you are beginning the role play from the midway. Okay? The child is not present for this part of the discussion. Find out more information about the child's symptoms, duration, possible triggers, changes in severity, treatment given, previous occurrences. We need to identify all these details about the child's symptoms. So, how to begin? You may begin like this. Thank you for allowing me to assess your son. Before I give you my assessment findings, would you mind telling me more about your child's symptoms? You can understand the softness in the voice. Why? Because we are talking with the concerned parents. Okay, they are looking for the reassurance. They are looking for your answers. So we need to be polite and we need to understand them. Okay. And as you can see, I have started by open-ended question. Would you mind telling me more about your child's symptoms? Okay. And how to open an interview? Thank you for allowing me to assess your son. Okay. No greetings, no hi hellos, no introductions. Jump into the conversation directly. Okay, so these are four ways to begin the role play, and we have seen four different scenarios. In the first scenario, it was about walk-in patient, where you need to introduce yourself, get the introduction of the patient, and you may directly ask, "How may I help you today?" or "How may I assist you today?" In the second scenario, we saw that we are unknown to each other, but patient might have booked the appointment. So we know that the patient with this name is about to come for so and so reason. So we are introducing ourselves, we are getting introduction of the patient, but we are either starting by giving the background information and you are here for so and so reason. Is that right? Or we may say that what is your understanding about today's appointment? Smart way. The third scenario in which we saw that uh, the patient is already known to us. Okay, patient has made one appointment. So instead of introducing ourselves, we are saying that, "Hello, Mrs. Smith, nice to see you again. How have you been since your last visit?" Okay. And in the fourth scenario, we are jumping into the speaking. Okay. It is in progress. And we are saying that, "Thank you for allowing me to assess your child. Now, before I give you my examination findings, would you mind telling me more about your child's symptoms?" Okay, so these are four various ways to begin the role play. I'm sure that I have given you the clarity about opening your role play. Now read the background information carefully, understand and imagine the situation, and begin with confidence. I'm sure you can do it. And in the next video, we are meeting to understand how to gather the information. Okay, it is about information gathering. And you all are experts in that, right? It's your daily task. So I'm eagerly waiting to meet you again. See you in the next video. Till then, bye bye.